Thus, patients with atopic dermatitis. How to manage relapses and restore the skin's barrier function. The management of atopic dermatitis, AD, requires a shift from episodic treatment of flare-ups to continuous restoration of the epidermal barrier and proactive control of inflammation. The fundamental solution: basic therapy for all patients. Emollients as a foundation. Daily use of moisturizers is mandatory even in the absence of active lesions. This is the foundation that improves the barrier function and reduces the need for pharmacotherapy. Environmental control. Identifying and avoiding individual triggers, along with proper hygiene, is an integral part of treatment. Stepwise control of active inflammation. The choice of treatment intensity depends on the severity of symptoms and localization. Topical corticosteroids, TCS, and calcineurin inhibitors, TCI. Mild course, reactive use only during flare-ups. Moderate and severe cases transition to proactive therapy with intermittent application of the medication to at-risk areas twice a week to prolong remission. Preventive measures in at-risk groups. Early intervention in infants. The use of emollients from the first weeks of life in children with a genetic predisposition may reduce the incidence of AD during the first year. Limitations. Data on the complete prevention of AD beyond early childhood remain inconclusive. Emollients may only delay the onset of the disease. What changes can be made in practice starting tomorrow? Prescribe emollients as a permanent therapeutic measure for skin treatment, not as a cosmetic adjunct, regardless of the disease stage. Recommend a proactive regimen of TIC or TCS twice a week for patients with frequent relapses to prevent the development of acute inflammation. Explain to patients that emollients have a safe profile and are the primary tool for reducing the overall steroid burden. Emollients play a critical role at all stages of AD management by restoring the epidermal barrier and directly influencing the frequency of flare-ups. To achieve a lasting result, it is necessary to combine continuous skin hydration with tailored anti-inflammatory therapy using TCS/TIC, taking into account the patient's age and the severity of their condition.